According to WebMD, juvenile rheumatoid arthritis, or juvenile idiopathic arthritis, is a type of arthritis that causes joint inflammation and stiffness in children ages 16 or younger for longer than 6 weeks. It affects approximately 50,000 children in the United States, and the inflammation causes redness, swelling, warmth, and soreness of the joints. And although it may cause these symptoms, children with JRA most of the time do not complain of pain. Juvenile rheumatoid arthritis is a serious autoimmune condition, and tasks as simple as getting out of bed in the morning can be difficult for children who suffer with JRA. As an individual who has JRA and still suffers with it even into adulthood, I can tell you firsthand what it's like to have this disorder. Today, I will tell you what it's like to have JRA, the different types, how it affects the body, the treatment options, how it's diagnosed, and what treatments work for me. Let's begin with what establishing JRA is. As you can tell on this piece of paper on the table, there is a joint that is affected by JRA and a joint that is not affected by JRA. As you can tell, the joint that is affected with JRA has more, I guess you could say, rough edges around the synovial joint, which means that your body disintegrates and eats down your cartilage lining your joints and causes swelling and pain, and that causes the, I guess you would say, pain and stiffness and swelling and all the inflammation. So, as I said, juvenile rheumatoid arthritis is an autoimmune disorder that affects as little as one or as many as all the joints in the body. However, the body's joints are the only thing affected by JRA. And the majority of the time, the child outgrows this by the time they reach adulthood. However, in rare cases, they can still have these symptoms into adulthood. The word arthritis literally means joint inflammation. And this form of arthritis is an autoimmune disorder, which means that your body attacks your tissues. There are 3 different types of JRA. There is polyarticular, which means that 4 or fewer joints are affected. This is the most common form, and then there is polyarticular, which means that 5 or more are affected. This is often the most advanced form or the most crucial because they have more severe forms. And then there's systemic, which means along with the joint pain, you would have a rash. And some of your internal organs, such as your heart, your lymph nodes, your liver, your spleen, your kidneys, they would all be affected by the arthritis and would break down and attack somehow. This is often called Still's disease and only affects 20% of children with JRA. Now that you know the types of JRA, let's discuss the symptoms, diagnosis, and treatment options. It is very important to know the symptoms and treatment options of JRA because if you don't know these, you can cause some irreversible damage to your joints. Symptoms include pain, swelling, and stiffness. Don't let this, I don't know what you would say, don't excuse this for just like a regular ache and pain because this could be something very serious. Diagnosis consists of blood work, x-rays, MRIs, and many specialist appointments. Treatment options include NSAIDs, DMARDs, biological agents, corticosteroids, therapies, and rarely surgery. Now that you know some background information on what JRA is, how many types there are, and what you would do to treat it, let's talk about my experience. I was diagnosed with JRA when I was 11 years old. It started when I was at the doctor to get my toe looked at, and he bent my knee and I jumped off the table in pain. They ran some tests. They thought it was lupus at first because I was in such pain. But my white blood cell count was not high enough for it to be lupus, so they somehow narrowed it down to JRA and sent me to a specialist at Vanderbilt in Nashville. I have 3 joints today that are affected by JRA, both of my knees and my right ankle. Methods of treatment that have failed for me were NSAIDs, which was naproxen. It ate a hole through my stomach mucus lining, which caused me to literally throw up everything that I ate, which was the most miserable thing in the world. oral steroids, which cause you to put on a lot of weight, and fluid and pressure release. These temporarily worked, however, the fluid just gradually built back on and I had the persisting problem I had before. The methods of treatment that did work for me were corticosteroids injections. I've had those in both of my knees and my ankle. I've had to have my ankle done twice because it's a joint that you use so often that the steroid eventually just wears out. So I had that done of April last year, and then I had it done just like 3 weeks ago. And now I'm on methotrexate, which is an immune suppressant. I take this to suppress my immune system so that my body doesn't try to attack my joints so I don't have any more flare-ups. That's a good thing, but the downside to the methotrexate is that it causes me to become more susceptible to flu, the cold. Like the common cold for me could be like the flu for a normal person. So I have to wash my hands more than usual. I have to watch what I touch, what I eat. I have to be very careful. And so that is how I'm dealing with my JRA today. Today, I've informed you about juvenile rheumatoid arthritis. You've learned about the types of JRA, how it affects the body. You've also learned about the symptoms, how it's diagnosed, the treatment options available, and I've also told you about my struggle with JRA. I hope that I've helped you and helped you gain a better insight into what it's like to have JRA.